A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells start to die. In one type of stroke, ischemic stroke, the artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy part of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. The blockage may be due to a blood clot that forms elsewhere in the body and travels to the brain. The blood clot lodges in a narrowed artery and obstructs flow to the brain. In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, a blood vessel bursts, spilling blood directly onto brain tissues, robbing them of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A weak spot in a blood vessel wall called an aneurysm can also destroy tissue. When the aneurysm bursts, it leaks blood into the tight space between the brain and the skull. This high-pressure bleeding causes serious damage to brain tissues.
So a stroke is an acute event. It's a sudden event where suddenly a person loses function. In the heart, when somebody has a heart attack because of lack of blood supply, they have a sudden chest pain or numbness or pain in their arm. In the brain, it's quite different. There can be many things because the brain controls many different functions. So we categorize those, or we try to knock those down into specific areas. So numbness, weakness in the arm, face, or leg, usually one side. Trouble speaking, understanding the spoken word, trouble with their vision, where they may go blind in one eye or have peripheral vision that's lost. And then issues with balance, where they suddenly have balance or problems walking, where they're very unsteady when they're walking. And then finally a severe headache, worst headache they've ever had in their life. See, it can take many forms. So the public has problems maybe thinking of when they're having a stroke and maybe when something is just a little transient episode. If they have any of those signs, they should seek medical care very quickly so that we can try to reverse those effects. Even if a patient has one of those signs or symptoms and they resolve quickly, they should seek medical care. That could be a warning sign for something bigger that's going to happen.
I was coming home from work. It was like on a Saturday morning. And I got a little bit lightheaded and a little bit disoriented. So when I came home, I laid down. And when I got back up again, the right side of my face drooped. I couldn't lift my arm and my legs. I couldn't move my right leg. And my wife saw me, and I said, wow, I feel strange. And she looked at me and said, Dave, you've had a stroke. I said, no, I haven't. I'll go see the doctor Monday. And so she said, not only no, but hell no. And she helped me to the car, drove me to the hospital, and got me in there as soon as she told the nurses at the emergency room that my husband's had a stroke. They just grabbed me, took me into a room, and started to take my vitals. Started to inject my stomach with stuff. I didn't know what my wife told me. But I do remember saying, we haven't filled out any paperwork yet. And the nurse just said, we'll take care of you first and take care of the paperwork later. And made me feel good. And they admitted me to a room, and I was so very fortunate that Mickey got me there so soon. Because I understand, of course, the longer you wait, the worse it's going to be. And I was out of the hospital in about a day and a half, and I felt okay, but they said you have to go to physical therapy. And I said I didn't need physical therapy, I was fine, I was moving around. But whenever they tested me, my right arm, and I'm right-handed, was so much weaker than my left arm. They said that's because of the stroke. And so I went through about 5 or 6 weeks of physical therapy till they said, well, you're okay now. I didn't have to go through speech therapy. I know for a fact if I was by myself, I would have just said, oh, well, I'll go to the doctors later. And if it wasn't for Mickey, I wouldn't have got there so soon. And so if I do feel like that, if I feel lightheaded, if I feel confused, and no pain, there was no pain whatsoever. That's why I felt there was nothing wrong. I know that I would not have gone to the hospital, and I would not be in the condition that I am now.